Hi, and welcome back to Uniqa Dental Show, where we discuss interesting cases and new procedures in the field of dentistry. Don't forget to like, share, subscribe, and follow us to stay tuned. With us today, as always, is Dr. Yanil. Hi.
Hi, how are you doing?
Amazing. How are you?
Can be better.
Can be better in this year. Wow, good to hear. Okay. I like your thinking. What did you bring for us today?
Something very interesting. Today we want to show a case where we did an immediate loading on implants on the lower jaw, cross arch bridge, 16 crowns, everything. In this photo, you can see that using intraoral scanner is gonna be hard job because you can see all the soft tissue around the healing caps, and you can see that the soft tissue is movable, it's not rigid. So when you're scanning, if you want to insert scan abutments in the places of the implants, you'll have a hard time. You won't enjoy the process because every time if you want to move from this kind of abutment to this kind of abutment, the gingiva will move a little bit, and the end product that you'll get at the end result won't be as precise as it's supposed to be.
These problems, from even the previous cases that we saw, it mostly occurs on the lower jaw.
Yeah, because in the lower jaw you have the tongue, and you can see this patient has a very large tongue. He didn't have his lower teeth for quite some while, and right now when you don't have the teeth, the tongue getting larger. So in this case, yeah.
Really?
Yeah, when you don't have teeth, the tongue will be larger.
The tongue itself?
Yeah.
No, I know that there is a bone absorption, but the tongue gets larger.
Yeah,
if
the
you
tongue gets larger. So the tongue is very large. You can see that when we place the implants, there is no place for the tongue. You always have the tongue in the scanning process. And you have all the movable gingiva around the implants. So if you put just scan abutments and you'll scan around the scan abutments, you'll get always different kind of texture, different kind of, the scan abutment will see different things.
The intraoral scanner can fixate on the points.
Yeah, it will fixate on the scan abutments, but between two scan abutments you have some gingiva, and this gingiva will always move a little bit, and in this case it will be very, very hard, almost impossible to scan those implants without any different type of methods or help. So we've waited about 3 days, and now we'll change the scan abutments now we'll change the healing caps to scan abutments. You saw previously the multi-units that we placed right after the surgery. We placed the multi-unit and the scan abutment on the multi-unit. On the multi-unit, then we took off the healing caps and we changed them to scan abutments. Now you can see 6 scan abutments. You can see that because it was done 3 days after the surgery, you don't have this large amount of blood. So you can, it will be a little bit easier.